Good morning, all. Am I audible? Okay. Morning, all. So we are starting our reading club with the prayer.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जय से पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning, all. We are giving tribute to a great master, Dr. Satyam, for this wonderful divine science as he gave to all of us and taught us dare to be wise. Seeking blessings from our Guru, Dr. Prafull Vijayakar, sirs, who have bridged this divine science with the modern science and made homeopathy easy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijayakar. So, friends, we are in the journey of understanding and learning the wisdom of Master Samuel Hahnemann from the 5th edition of Organon of Medicine, along with the reading of Genetic Materia Medica. So, in Organon of Medicines, up till now we have covered the theoretical part and the practical part. In the practical part, we are dealing with the local maladies and the local diseases. So, what could be the guideline when you are treating the local disease or local malady? So, in continuation of this, that indeed it might seem as though the cure of such disease, that means the local disease, would be hastened by employing the medicinal substance which is known to be truly homeopathic to the totality of the symptoms. Not only internally but also externally, because the actions of the medicine applied to the seat of local affection might effect a more rapid change in it. So this is what Master Hanuman is telling about, that you just not match the local affections of that particular internal cause or internal disease, but also you can understand externally. So in previous lecture, I have shown you that by just looking at the characteristic of the local lesion, you can understand that this is what the totality of the symptoms. But, and also he has said that when you apply the medicines externally as well as internally, then rapid change will happen. But what he mentions that why topical application is not applicable. So, however, this treatment is quite inadmissible. That means the local applications as well as external or internal treatment. So it is inadmissible not only for the local symptoms arising from the miasm of the sora, but also especially for those originating in the miasm of syphilis or psychosis for the simultaneous local application, along with the internal employment of the remedy in the disease, whose chief action is constant local affections, has this great disadvantage that by such topical applications, the chief symptoms, that is the local symptoms which we have, will usually be annihilated sooner than the internal disease, and we shall now be deceived by the semblance of the perfect cure, or at least it will be difficult and in some cases impossible to determine from the premature disappearance of the local symptoms if the general disease is destroyed by the simultaneous employment of the internal medicine. So in this case, what Master Hanuman is warning us that do not apply local applications, because when you apply local application, it might having the semblance with the what we call as the disease symptoms, and it may destroy the local symptoms. But after the destroying of the local symptoms, the internal symptoms has not been destroyed. So it is called as the primary symptoms of the sora, like the itch, primary symptoms of the condylomata, and primary symptoms of the chancres. When applied the caustic treatment or applying the Huja ointment or something else, and it will destroy. But the internal process is going on, so it cannot remove it in a wholly, so that Master Hanuman said that it is quite inadmissible to apply the topical treatment. So that was also written in a footnote number 114 that the recent each eruption Shankar or Pendulumta, as I have indicated in my book of chronic disease. So when you have the each eruption Shankars and condylomata, it can be destroyed by the local topical applications, and then the internal disease remain as uneradicable, and then the case becomes. That is what Master Hanuman is advising us. So this is a few wisdom of understanding of Samuel Hahnemann to all of us in local disease. And further, the continuations of our genetic materia medica by Dr. Prafull Vijayakar. So in this book, we have completed many groups, starting from the Baraita group, then Calcaria, the Kali group, and the carbon group. So in carbon group, we have studied the two remedies, that is one is the carbovage and the graphitis. So in continuation with this, today we are dealing with the petroleum, the another carbon remedy. The most homeopaths, graphitis and petroleum are the remedy best known as the skin remedy. So many a times, whenever we are not understanding this remedy in a proper sense, then we apply this remedy for particular disease only, and that is what a skin disease. Whenever cracks are seen on the palms and the soles or any mucocutaneous junctions, this remedy are first to come to the mind. This highlights that these two carbons have a genetic tendency to crack in the skin. Besides the large scale scaling and the formation of the hermes in what appear to be psoriasis, this remedy has been extensively and blindly used by old homeopaths with a remarkable result. The people who do not know the principle of homeopathy have also converted it into creams and ointments, and this may have given them a miraculous result in making the skin lesions disappear. But what occurred to the patient later on was never ever cared for. So this is what the same thing what we are dealing in our understanding of the local disease, not to apply the topical means, as Dr. Vijayakar sir also told about the same things. The many homeopaths, like allopaths, may have created a dangerous disease in these patients that they are blissfully unaware of. To warn against this, Hahnemann has given us a few aphorisms in his organon. So aphorism number 202, if the old school physician should now destroy the local symptoms by the topical application of the external remedies, under the belief that he thereby cures the whole disease. Nature make up for its loss by rousing the internal malady and the other symptoms that previously existed in an latent state side by side with the local affection. That is to say, she increased the internal disease. So this is what very important that again Master Hahnemann is warning us not to apply the external remedy. The following case made me understand this aphorism as well as the petroleum well, and hence I would like to narrate it here. So this was the case came to the sir and how this came as helping the sir to understand the process. So a lady aged 42 years having two children came with the complaint of losing weight drastically and something wrong with her mind. She was running a bakery along with her husband and she started her story as follows. Doctor, I am having a great problem. The problem is not understood by doctors. I have tried a lot of allopathic medicines, but I have had no relief. I am losing weight drastically despite eating well. Secondly, I don't know how to explain, but something is wrong with my mind. Why? What is wrong with your mind? This was asked by sir. So it's a funny. I can't explain it to you. You call me mad. My husband laugh at me. You know, I can't understand which directions I'm traveling. This is since last 6 weeks or so. I thought it may be some temporary things, but now it's becoming worse day by day. I go out early in the morning for a walk to the park. I don't seem to realize whether I am going round the park in a clockwise or anti-clockwise direction. So, sir asked, how does it matter? I asked just to make her comfortable. No, doctor, it's funny. After the walk around the park is over, I don't know whether I should turn left or right for my house. I know you will laugh at me because I have been living in the same place for last 20 years. My husband said you are not sleeping sufficiently at night, and so I started sleeping early to get at least 7 hours of sleep, but still it's becoming worse. Are you forgetting? That's what the sir asked another question. Are you forgetting your house or your address? No, I get confused in the directions. When I see my house, I know it's mine. I know the address too by heart. But here it is the direction in which to turn, I am not sure. Similar thing happened today when I left my house to come here. I was baffled as to which train I should board and the one going north or south. I had to literally ask someone to guide me. This is too much because I came to Villa Palace so often. So this was the definite confusion in the mind. The confusion means the control over one faculty of the intellect is lost. So this is the patient is experiencing lost or the illusion. The patient is not in a control of her power to decide the directions. This but the control manifestations mean syphilitic. As per our understanding, the destructions or the destructive tendency has already invaded the mental faculty. But before this tendency went to the mind, it should be have been in the body somewhere. So a direct question was asked to her. About 2 months back, did you take any treatment for anything or any illness? The question was no. Our answer was no. We should now to hunt for some probable syphilitic illness. Here, a direct question is required contrary to the established norm. This is because the relation between the physical disease and the mental disease is not clear in the layman's mind. We as a homeopath need to make them aware and as a reminder ask them questions accordingly. So, commonest symptoms that precede the confusion of the mind are the viral bacterial fever, antibiotic taken for a fever, or any injection taken, diarrhea suppressed with the allopathy, homeopathy, or Ayurvedic treatment, treatment for the dengue fever or a malaria, or hypertension treated for the prolonged time and antihypertensive, or thyroid suppression, etc., may lead to a confusion. All of the above reasons were not present. So, the another question that Dr. Vijayakar sir asked that did you go to a dentist and have your teeth treatment done? The answer was no. And then I framed the questions in another way. What was the last medicine in a tablet form or a capsule form or an ointment or a cream that was used by you and when? So after a mixture of wondering, she said, "Yeah, I have been using a flucot ointment for my skin for last 3 months or so. This time, someone gave me a homeopathic ointment, graphitis, and it worked like a magic. But what can be the reaction relation of the skin ointment and the mental confusion?" That was the question by them. So I think it is too far-fetched to relate them. Why were you using this ointment? Was my questions again. Oh, I use it every winter for last 4 to 5 years because I have this tendency to get eruptions in my groins every winter since childhood. Now, since the last 4 years, I have started getting cracks on my hands and feet. Show me where those cracks are present. Sir was asked. Oh, they have disappeared completely. This time, in fact, they healed very fast. They were more in the right hand. Are you still applying the cream? Sir asked. No, I stopped applying it 2 months back as soon as the cracks and eruptions cleared up. So this case will be classically give the example of what Master Newman is telling us. That when you destroy the topical symptoms, then the patients land up with the higher version of the disease, and then it is very difficult to elucidate how the cause is. So this is what Dr. Vijay sir, who understand the patient and asking the question in a manner. I proceed to explain her that the destructions of the skin that expressed itself as a crack was with the bleeding was not cured. The tendency at the genetic level to destroy was still lurking within. Since she did not allow it to destroy the skin, this very process or a tendency has shifted to the more important organ like a brain or a mind. Now, the control over the direction and the locations faculty of the mind was not in her control. It was impossible that later she would lose her memory and even her sanity and become mad. This is the operations I want. She was told that if she was to be cured of her confusion and in her mind, her skin cracks had to return and further her eruptions in the groin that were since childhood also should return and then disappear. She was not easily going to accept what I said and started arguing with me. If what you say is true, tell me why all these years this separation from the skin to mind did not take place in spite of me using many creams for so many years. So her question is very valid, but the explanations I offer to her lead her to believe in me. I told that everything doesn't break so easily. If this wooden table is to break, it will break if it is weakened. An iron rod will also break if it is weakened. A car tire will get easily punctured if it becomes old, worn out, or weakened. Thus, even a disease cannot get suppressed easily if the mind and body are the strong and resistance of the person is good enough. That is the immunity. Only if either of them is weakened, the chances of suppression or the transfer of the disease increase. If your mind has been affected, the disease has traveled directly from the ectoderm skin to the neuroectoderm, the brain, and this means that her mind was weak for some reason. What was the tension that you have of late? Was the question asked to her. So this is what something how the mind got weakened. You are right. That was the answer by the patients. Our shop is in a rental place. The owner died recently. He was having a good relations with our family, but now his son wants to break this shop and construct a big tower here. They were selling it to a builder who is a rough. row and does not want to give us any place in return because we have it on a rental basis. This means disaster for us. We do not have money to buy a new one. What will happen to our business? Where will we now shift our battery? What will be our futures? Will we be successful in a new place? This and many other questions worry us. Practically every night we have a meeting. I'm trying my best to get good deal for us. My husband is very meek, mild, and reserved, so I have to do and talking. So this is the situation that. But I said you two are very quiet persons. Yes, I am a quiet, but when it comes to finance, I am quite stern and I fight tooth and nail. So that was the money-minded personality. My next question was, do you get confused in a day-to-day money dealing since you are the cashier? No, except for my directions, I am not confused. So another things I have marked is that I get confused more when I am thinking and exerting my mind to find the solution to the problem. So that was the exercise of the mind to cause the confusion. So above history shows that the lady had a sphoric eruption in the groin, returning every winter. So this she suppressed to convert into syphilitic cracks with the bleeding, and the syphilitic cracks were suppressed that went into the confusion of the mind. So this is the journey of the disease. Now aphorism number 21201, Hanuman says, it is evident that the man's vital force, when encumbered with the chronic disease which it is unable to overcome by its own power, instinctively adopt the plan of developing a local malady on some external part solely for this object, that by making and keeping in a disease state the internal disease which otherwise threaten to destroy the vital organ and to deprive the patient of the life, and that it may thereby, so to speak, transfer the internal disease to the vicarious local affections and as it were draw its thither. So this is what when the patient's recurrent eruptions occurring every winter, it is obvious that the body is trying to compromise with the genetic tendency of the flora and keep it at the least important organ in the skin. By applying creams, the internal genetic tendency or the cause was not being treated. By not allowing it to be expressed on the skin, the gear of the defense changed to destructive, that is syphilis. This converted the rash-like lesion to the cracks. The expressions changed from the sora, the first or the physiological defense process, to the syphilis, the third destructive process. This gives us the clue that the constitution is a thorough-syphilitic remedy. She was slow person, generally non-interactive, timid but argumentative and quarrelsome. She was right-sided. In a timid and right-sided person, we can think about the Calcarea, Kali, Baraita, Carbons, further Ignatia and Septa. If she was a Calcarea, she would not fight alone and would require a support. If she was a Kali, she would be fast, jerking, and startling, at least in the Sora, which was not the case. She was not Baraita since her intellect was too good. She was not Sepia because she was not indifferent to what was happening to her shop. She could then be a Ignatia or a Carbon. There was a grief that shooted the Ignatia. There was an independence that shooted the, I don't know what it was written, Rujatwa personality. She was physically lean, mean, and even chilly, like Ignatia. Ignatia relieved her temporarily, but did not cure her. So Ignatia was the partial simillimum. So previously, the Ignatia was given. So Ignatia gave her mental peace and tranquility. She was happy that she was less tense, but the confusions of the directions of the locations persisted. Above all, though, of a cure or a herring's law of a cure was not seen coming true. The cracks did not disappear. Cracks did not reappear. Though many homeopaths are happy with such general sensation of the well-being, a predictive homeopath cannot be happy because the prediction that her old symptoms will reappear has not come true. The suppressed eruptions and the tendency to crack is still lingering within them and might soon destroy something else. So Ignatia was not the genetic constitutional simillimum. Why did this occur? The answer is that the syphilitic aspect of the case, which was very peculiar, was not considered while prescribing that is the direction of confusions and emaciation with the good appetite, nor was the soric part was taken into consideration. That means the slow, timid, and introverted basic nature of the persons. We needed a remedy. So this was the analysis by the sir that we need a remedy that should be miasm is chlorosyphilitic, that means inflammatory and destructive in miasmatic process. General makeup is chilly, right-sided, slow. It took many years for Sora to convert into syphilis and many years for syphilitic destructive tendency to go towards the mind. So that means the remedy is slow in character. The mental makeup, the will, timid, introverted, meek, intellect is good, sharp. She was the one who understand the intricacies of property problem better than her husband. Besides, she was educated well. There was nothing marked about her morals and conscience. She gave more importance to the money than her husband would. As such, also, she was handling As such, she was handling the finance part of the business because she was good at it. In physically, the soric state, the remedy had to have tendency to the eruption. The mental exertion aggravate the confusions. The more she was thinking of solutions to her problem, the more her confusions increases. So this made us think of the carbon, and she could it be a carbon, but which carbon? So she was slow, timid, introverted with the skin problem. So we have a two carbon remedy, is graphitis and petroleum. She was right-sided, more in favor of petroleum, whereas the graphite is composed of the iron and more sensitive. That's why it is a left-sided. But which carbon should be she who could be? So she had to be a carbon that has the skin eruptions, cracks, that too bleeding. What carbon could have she be? Graphite or petroleum? Again, the same question. So one question solved the problem. Do you have a travel sickness? So this was the things when you have to rule out the petroleum from the carbon, other carbon. So question to be asked that sir always asks, do you have a travel sickness? And the patient says that yes, she said. Well, that was another question. What happens? Then she said that it was a headache or gastric problem or a nausea. So answer is I get a severe nausea and vomiting from car travel. Sometimes I feel like passing stool also during the car riding. So this is what something that the vomiting general riding in carriage while or headache riding in a carriage while. Her build was also not obese like a graphite. So she was not emotional and sensitive like the graphite. She was not left-sided like a graphite. She did not have a gluey discharge as in the graphite. Petroleum could not be ruled out on any part of the genetic tendency. Means miasm, mental makeup, physical makeup, general makeup, and above all the disease makeup. In syphilis, the confusion in locations and when there is a mental exertion in the sura, cracks in the skin. So this is what the whole case cracked. So whenever you are dealing with certain carbons and if you are confused between the two things like graphite and the petroleum, the first question to be asked, do you have a travel sickness or a riding carriage aggravation? If it is a riding carriage aggravation, you can directly think about the petroleum. So this was the case that helped us to understand that how the local symptoms as destroyed and it can lead to the further disease. So this is what Master Hahnemann's aphorism also tells us. Now we are dealing with another case, and this is a very beautiful case that helps her to understand the petroleum personality. So a case of a 14 years old patient who was suffering from a wide discolorations of the skin and diagnosed as leukoderma. Now, leukoderma is a condition wherein the melanocyte that gives color to the skin are progressively destroyed. This is more prevalent in tropical countries and especially in India, where it seems obvious and glaring due to people having colored skin. So this patient presented herself accompanied by her father at our outpatient department in the government homeopathic hospital. The first impressions that I got of this patient was that there was something wrong with her name. So the patient in front of me wore a pant and a bushers and was sitting on a stool with two hands in the knee and elbows spread wide apart. This up and go positions is acquired generally by younger robust boys who are ready to stand and walk away. This is also called as ready positions, showing that he is ready for any challenges. It came as a shock to us as the name indicates that the patient to be a female. The look were completely masculine, right from the hairstyle, clothes, and absence of any female ornaments or the vanity. The lipstick, eyelashes, raw earrings, necklace, bangles that forms a common sight at this stage of a girl were consciously absent. The father confirmed she was a girl, but had no pretensions of being one from the childhood. The leukoderma spot had started on the body and gradually ascends up to the neck and face, though some homeopathic treatment was going on. The homeopathic treatment given to her was arsulflavon 200 three times a day, as is the trend of bronch homeopath, who use this remedy as specific for this condition. This doctor boasts that the spots on the hands and trunk were cured because of this medicine and lured the patient to continue his treatment. Ignorance is bliss, says certain saying. This does not hold good, at least in the medical science. Every homeopath should be a knowledgeable physician first and a homeopath later. Little does this ignorant homeopath realize that he is not curing, but actually harming the patient as the disease was progressing against the law of cure, which is must for every cure. The symptoms have to disappear in the directions of the above downward, inside out, center to periphery, from more important to less important organ, and reversal of the directions of the appearance. The patient whose symptoms are not following these directions are not proceeding towards the cure for certain. This is as far as the Herring's law goes. Further, my addition to this law of cure is reversing the miasm. The patient whose genetic code is ordering the process of destruction, syphilis, at various organs and tissue has to be stopped and reversed to either the process of construction, the psychosis, or the process of inflammation, the soda. It is very important for a homeopath to know the anatomy and physiology in the human being if he has to treat the patient correctly. So the pigmentation is due to the melanocyte cells. These are situated below the transparent epidermis and give it a color. The melanocytes are being stimulated by the MSH, melanocyte stimulating hormone, secreted by the pars intermedialis, the central lobe of the pituitary gland. In these girls, the destructions of melanocytes become less in the spot on the hand and trunk. It increased to the neck base, showing that the deficiency and the supply of MSH was first lower and now on the upper part of the body. This means that the destruction was increasing upward and was very near to the brain and the pituitary. So this is the process. On asking minutely, it was found that this girl had developed liking for boys' dresses, boys' games, and all mannish habits only as the leukoderma spread upwards. This indicates the destructions of the melanocyte secretions from the pars intermedialis of the pituitary, from where the FSH follicle stimulating hormone is synthesizing along with other female hormones. Thus, a very basic sex determination was taken. This causes lower amount of the female hormone being secreted and therefore relative higher amount of the male hormone and organ giving rise to the managed personality. So this is very important that the higher center is at affections and producing the destructions of the physiological hormone and leading to the behavioral changes. The homeopaths, due to this ignorance, had converted these normally heterosexual girls into a nothing short of the third sex. Her menses has not appeared even at the age of 14 years because of the same reason. Here, the reversal of the disease will not mean only to reverse the white spot, but colored spot, but reverse the disease from above downward. So, in the following, normally the homeopaths look out for the improvement in the color of the spot to conclude that this remedy is right. A slightly better homeopath looks out for the right direction. It means the upper one disappearing before and the lower ones. But a really good homeopath who has the knowledge of predictive homeopathy will first not look at the spot at all. The destructive tendency is present at much higher level than at the melanocyte level. It is destroying her sexual determinations and the identity. We need to change her into a girl first. After that, will the directions of the cure be considered? So this was the understanding of Sir that how to take a follow-up in such cases. Now we know that such reversals can occur only by the right simillimum. The right simillimum need to incorporate the important genetic traits. Only then and only will the reversal of syphilitic destructive process and genetics will begin. So let us see what are the other characteristic symptoms that indicate us to the right GCS. So she was round-faced, stout in the build, looked quiet and timid, and was slow in the answering. Her father said she was a very quiet and a reserved girl, did not mix up with the people because of her shyness, but she said her shyness disappeared as she goes on the stage to perform. She can dance well, so there is a timidity, bashful, timidity alternating with exaltations. Dance, she can dance well, sing well, and literally hold the crowd with her performance when she is in a full flow. She is different there on the stage, but when it comes to one discussion, she is very timid and afraid of any new persons. Her leukoderma was one-sided. It was first on the left hand and left side of the abdomen, left side of the neck, and above the left eye. Before the leukoderma started in the childhood, she used to have a skin eruptions that was suppressed. She was chilly and thus was not defined. Now, what was the analysis? That this was the analysis that we need a remedy. That was a physically stout. We need a thermally a chilly remedy. We need head affections only on the left side, or a remedy had to be a slow, a remedy had to be a timid, bashful, quiet, psychosis, and introverted, alternating with the exuberance on the stage. And above all, the most important things it should cover must be the syphilitic aspect, that is the man's or the boy's character. So it goes without saying that the most important rubric or the characteristic that on any remedy should cover is the man's habit, as the constitution itself can go to the extent of sacrificing the sex identity. The most important of all our characters is the sex determinations that occur right at the conceptions when an XX chromosome or XY chromosome of the new progeny is decided. The sexual identity is thus the most important of our being because all other organ system, hormonal synthesis, and other traits are ruled by it. When the man marries a woman, and that is what is most natural, they can reproduce and produce children to keep the species of the man alive. If man or a woman does not abide by the nature's principle and use their sexual organ only for the enjoyment and not for any biological functions, there will be no reproductions and the species of the man or the human being will be endangered, if not extinguished. This is perversion and frankly destructive miasm that is syphilis. This tendency to get attracted to the same sex can only be treated and cured by homeopathy based on genetics. So this is very important. You can treat perversions only and only with the homeopathy. No other science will treat that. So how many remedies sacrifice the sex identity to save the whole? So let us see the remedy covering the rubric managed habit of the girls or the woman. This is a combination of both. So we have a carbovage, we have a simizifuga, we have an etramure, we have a platina, we have a petrol. Additional to it, the manuscript the human is a fluoric acid. So when we have this, so we have a chart, the manuscript of the woman or the girl. So we have to divide into two categories, the hot remedy and the chilly remedy. A hot remedy can be an etramure, platina, fluoric acid. Chilly remedy can be carbovage, carbons, petroleum, and the fluoric acid can be chilly, can be hot because fluoric acid having a buoyant tendency, so they can adjust to any thermal also. So that's why sir has written into it. Then the we need to understand the chili remedy, but having an introvert or extroverted personality. So if it is introverted, then the carbons. If it is extroverted, bold, active, outgoing, and flirtatious, we can directly think of it as a fluoric acid. So here the introvertedness is there. So we know she is slow, timid, quiet person. Therefore, carbon. And we have to differentiate between the carbovage and petroleum. Now, carbovage is extremely dull and unemotional. The petroleum has loss of emotions. Her reactions are frightened easily, angry easily, quarrelsome, etc. One of the most important features of petroleum is paroxysmal affections, symptoms or emotions always alternating as well as come suddenly and go suddenly. There is always an ups and downs like the belladonna and colossus, etc. So there is the alternating symptoms there in the petroleum is dullness alternating with the excitement, redness alternating with the exuberance, timidity alternating with the exaltation, timidity alternate with the sadness, eccentricity alternate with the sadness, and mirth liveliness alternate with the sadness. As against this, carbovage is a slow single directions remedy. There is no changeability. Beside, the sora was in the form of eruptions and the suppressions of which had led to this leukoderma. So, on the basis of this dispositions and this understanding, the petroleum was selected and petroleum 201 dose was given. So, what was the follow-up? Within 1 month, this girl came to the clinic and the father said she is showing interest in buying feminine clothes. The second month, this girl came in the feminine clothes with the lipstick and other makeup. She started wearing earrings and bangles too. The above changes shows that her original sex, feminism, was on the rise, with the male hormone taking a backseat. Her appearance of the menstrual cycle, menarche, was the first complaint that the rolling stone of the Herring's law had sat in, with the gradual disappearance of the leukoderma from above downward, right up to eruptions that were suppressed. So this is very important that the behavior has been changed. That means the sexual identity has been created, followed by she developed menstrual flow, menstrual cycle. The menarche has been started. That means the feminine character has been started, and followed by the gradual disappearance of the leukoderma. So when can we think of petroleum? So when we think of petroleum, when there is a chronicity of the complaint, when we see the patient ill for a long time, when the patient gives the history of the skin eruptions or the cracks, so you can think of the petroleum. It is just like any other carbons or the carbovage. In carbovage, there is a suppression of the acute inflammatory disease like a pneumonia, whooping cough, acute attack of the cholera, dysentery, jaundice, abortions, and infantile death that ultimately result in the looseness, relaxation in the gastric and cardiovascular system. But in petroleum, the genetic tendency is not to produce looseness in the muscles, but the mind is affected. So that is what the difference between the carbovage, and the petroleum. Now, what is the genetic reflections of miasm in petroleum? So, genetic miasmatic reflections in petroleum is the miasmatic journey of a petroleum. So, after SORA, the second defense is always a psychosis, but in petroleum, the suppression from the skin eruption and into cracks on the skin. When the soric eruptions are separate, it goes straight to the syphilis. So, this is what a sorosyphilitic carbon. SORA, then syphilis. So, SORA directly converted into syphilis. So syphilis is expressed on the physical and the general level in the forms of the cracks on the skin, cracks on the hands, and with the bleeding. There is a car sickness, tolerance to the car riding is destroyed. The car riding can cause nausea, vomiting, and diarrhea. Again, alternating state is also a sorosyphilitic in nature. Mentally, there is a confusion. So the mental psychosis is there, and psychosis lead to the syphilis. So this is what you have to understand. So mentally, there is a confusion of specifically the identity, confusion of the directions and location, confusions from mental exertions, and finally land up with the managed behavior of the girl. There is one rubric, there is a delirium, body is double, someone is lying next to her in the bed, and body is made up of food, that she is poisoned and going to die and has to hurry to settle the will. So this is what the few symptoms of delirium that help you into understanding of thoracocephalic petroleum. So another peculiar case, there was a patient whose wife complained that his vest got torn at the two particular point. Every time she got a new vest for him, it would tear at the same part. She brought two to three vests to show it to me, which had similar tear at a particular point. All were torn out at the same part, and around the torn portions there was a slightly reddish yellow discoloration. She asked me why did this happen. Her husband, who was a patient, seemed to be timid and mild and did not have any complaint about it. If this vest was torn on a particular part and that also identical in all the vest, the reason could be either the friction at that particular part of the body, scratching at that particular part of the body, the effect of the perspiration. The first two were ruled out on the further interrogations. The culprit was found to be the perspirations at the part. The stain where the reddish yellow is like or an old blood stain, this was a characteristic symptoms and that too syphilitis. So we need a slow timid remedy which had a perspiration only on one part and the only remedy is petroleum was confirmed by the history of suppressed eruptions. So this highlights two things about the petroleum. The petroleum has perspirations on the particular part and the reddish stain indicate the bloody perspiration. So on the other slow, sluggish, timid remedy which covers these three symptoms is the calcarea carb, perspirations on particular part, bloody perspirations, and irritability. The other remedies are the arsenic, china, lacacis, nux vomica. This remedy are irritable, restless, whereas calcarea and petroleums are the slow and sluggish. The very fact that the husband did not want his wife to tell this showed that he did not want support, and that itself ruled out the calcarea carb. So this is what understanding of this case can help you to understand the how petroleum is. So petroleum is a sorosyphilitic remedy mostly and it can lead to a destruction at the level of mind when the skin symptoms has been suppressed on the ectodermal level. So this is our basic understanding of petroleum. So let's see, we finish the previous one today also because we have 10 15 minutes time. So the fourth remedy which we think of is creosotes. Creosotes, the triad of creosote is it is a rapidity and the emaciations fast. The carbon which is fast in actions and destructive, that is the creosote. The emaciations and the decay of the teeth, which is rapid. We all know that all the carbons have the offensiveness, but this creosote has more offensiveness and the productivity of the all the discharge. The discharge are the hot, burning, and corrosive, chilly, old-looking, lean, thin, tall people like a phosphorus and restless and easy bleeding tendency. So this carbon has a hemorrhagic tendency and a contradictory symptoms. If we found these fruits and triad of the symptoms, then we can understand this could be a creosote. So entry point for the creosote in short. So emaciation is general. So mostly the lean emaciated carbon. Others are generally obese. They are thin wrinkles and old-looking peoples. Their characteristic symptoms are the rapidity. So rapidity of the symptoms like the belladonna, the symptoms progress very fast. So rapid decay of the teeth, tooth decay as soon as they appear, rapid emaciations, all disease, even cancer progress very fast, blood oozes out of the gums or a wound very fast. They become anemic very fast. So this is what the rapidity of the symptoms. Another thing is the offensiveness or putridity is a marked features of the all carbon, but here the putridity is more marked. So offensiveness from the nasal discharge, from leukorrhea, from urine, from ulcers, the bad odor from the decayed teeth or diarrhea. So all the discharge secretions are very offensive and fishes, leukorrhea very offensive and putrid. The third point is the hot burning or a corrosive discharge. All the discharge can cause corrosions and burning. So burning in the vagina from poisons, the soreness, burning and excoriations of the labia and vagina. So there is always a acrid leukorrhea, hot acrid burning leukorrhea, soreness and burning in the mouth after irritations. The gums are hot during dentitions with the excessive thirst, easy bleeding tendency. Again, the this carbon having the easy bleeding tendency, so wound bleed freely, profusely, come bleed easily on touch, cervix bleed on touch. So how you can feel that cervix bleed on touch? So many a time the patients or lady came to you with the complaint that whenever we had a relationship and after the relationship I do have a menstrual cycle or I do have some spotting. So that is suggestive of that she had a fragile cervix leading to bleed on touch. Okay, and there is one another symptom that lady says that there is the offensive discharge from the vagina. So it can be the one of the best remedy for the cervical cancers or the best remedy for the cervical erosions with the acrid offensive leukorrhea in old wrinkled people, look old looking wrinkled peoples with the emaciations. Menses aggravation, slightest exertions. After every intercourse, the bleeding starts. This is very important understanding, specifically in the cervical erosions or cervix may land up into cancerous conditions. Contradictory symptoms. So these are the very important. The contradictory, the pain, dysmenorrhea aggravated after the menstrual flow. The menses flow while lying down, seizes on sitting or walking about, can only urinate while lying down, wet the bed while dreaming. He is urinating normally. He wakes up but cannot arrest the urination. So there is one thing that dreams urinating while or dreaming urinating and she urinate in the bed. So that is what very important. Stop brings the restart. That means menses intermittent stop and restart in the full flow. This is what the different. What is the stop brings the irritation. Lochia ceases and reappear again. Ulcer almost heal and reopen again. So this is what the creosote is. Other symptoms when we can think of creosote in our clinic that we have a chilly, old looking woman, a scrawny, wrinkled face, emaciations, very bad odor from the mouth and when they enter into the clinic. There could be due to the cancer of the cervix or a putrid leukorrhea or a lochia or offensive urine that has spurted out involuntarily with the cough. So this is what the offensiveness is there. Small children who are restless during teething and who cry from sunset to sunrise, like Mercury, who has to be careless and they won't sleep with hot gum. This is the indications of the creosote. When we see shrieking, thin, scrawny, old-looking infant, you can think of creosote. Genetic reflections of the creosotes at mental sphere, the need of the creosote is safety. We all know that all carbons need is a safety and a security. So mostly the carbons are the money minded, their need is safety. So here the creosote need is safety also. Sora, it is because of this safety there is a creosote patient become excitable, restless, and develop a startling tendency in the soric miasm, like the colic. In psychosis, psychosis is very subtle, not very prominent in body. The psychotic picture of the carbon means the slowness and timidity is seen along with the anger at trifles and the constant discontent. Though most carbon do not like consolations, creosote loves fondant and caresses. Children who are lean, thin, timid, restless at night, and do not sleep easily without the mother sitting next to them and caressing and fondling them could be the creosote if other genetic characteristics coincide. So this is what very important understanding. Like pulsatilla, mother sitting, they want mother and caressing and fondling. Syphilis, but the reactions is predominantly governed by the destructive miasm, which is syphilis. Hence, the picture of creosote is predominantly a syphilitic, and that too on the physical sphere. So, physical destructions occasionally goes to destructions or out of control at the mental level. For example, there is one rubric that insanity from hemorrhage. So that is example was given acute hemorrhage followed by insanity, the forgetfulness after epistaxis. So this was the case of the man, a lean, thin, 78 years old man, angry man, a known hypertensive, complaint of the severe bleeding from the anus. He was an angry man who could not bear contradictions, yet too timid to fight. The bleeding was so profuse that the whole commode used to get filled up with the blood. He had to be immediately hospitalized as he was losing a lot of blood. In the hospital, the bleeding was stopped with a great difficulty, and all investigations were carried out to rule out the chances of cancer, polyp, or hemorrhoids, etc. All the reports were normal. The bleeding had stopped, but slowly he started becoming dull and drowsy. By the time he reached home, he had become forgetful and was labeled as senile dementia. So this is what forgetfulness after epistaxis or acute hemorrhage followed by insanity. So the creosote was given to him on the rubric that acute hemorrhage followed by insanity. This tendency to forgetfulness after every bout of the pile bleeding was reported from many years. Other symptoms about he having a discontented nature and anger at trifle, as well as the chronicity of complaint. The putridity and offensiveness of the discharge attracted attention to the creosote. He improved tremendously and was completely cured with this remedy. So this is very important. Second, forgetfulness after epistaxis. The mental attitude of these people were who are lean, thin, and angry is that they cannot bear contradictions and get angry when things they want to refuse are to them. Angry when things they want are refused to them. So this is what a capriciousness is there, like a pulsatilla, fondling like a pulsatilla, but the difference is the pulsatilla is a slow remedy, whereas creosote is a very rapid remedy with the discharge. Pulsatilla leucorrhea is a blend, whereas creosote leucorrhea is acrid and hot and offensiveness of the discharge. So this is what you have a difference between these two remedies. Whimpering, the complaining of these people called as the whimpering, imaging an old emaciated lady with the cancer of the cervix coming to your clinic already weak and prostrated due to the profuse bleeding. She will be complaining about her miserable plight with no one wanting to come near her because of this offensive order, which is due to no fault of her. This sad, melancholic, weak person will complain in a tremulous, half-hearted voice. This is called whimpering, and this is also one of the peculiar symptoms that attract our attention to the creosote. So this is what very important. Talk whimpering. So this is ending up the whole carbon that the carbon is divided into four categories. The carbovage, graphitis, petroleum, and creosote. Carbovage is more psychotic, graphitis is psychosyphilitic, petroleum sorosyphilitic, or and the creosote is syphilis. Even petroleum can be psychosyphilitic, but psychosis is their confusion at the level of mind. The right-sided and chili carbovase is right-sided and chili. Graphitis is left-sided and chili. Petroleum is right-sided and chili. Creosote is right-sided and chili. Carbovage is obese and thin in syphilis. Graphitis is obese, whereas petroleum and creosotes are lean and emaciated and thin peoples. In carbovage, there is a timidity, anticipatory anxiety, anticipations, affectionate, and not so angry. but that anger expressed in the form of sarcasm. Graphitis is like pulsatilla, sad, melancholic, weeping, emotional, and indecisive. Petroleum, mild yet quarrelsome, alternating states, dullness alternating with excitement, and angry remedy. Creosote like to be caressed and fondled. In carbovate, there is a stasis and offensiveness of the discharge, desire, fanning, or airing the motions. In graphitis, carriage riding aggravations, headache, but emulated hearing, fluid discharge, and the hardness of the skin. Whereas in petroleum, all the gastric disturbances from the carriage riding and managed habit of the gulls. Whereas in creosote, there is a rapid decay of the teeth, rapidity of the complaint, the putrid, corrosive, offensive and the hemorrhagic tendency, a bleeding tendency. All carbon have a passive hemorrhage, whereas this creosote having a rapid hemorrhage or fast hemorrhage, a bleeding tendency. So this is what carbon in short. So tomorrow we will conclude this book and thank you for being with us in a reading club. Tomorrow we will have a little question answer sessions. If you have any questions, let me ask tomorrow because tomorrow we will have a short span to finish this book and we will have a few minutes left. So we will have a question answer tomorrow. Thank you. Thank you so much. Dr. Hetal, you had asked some questions that in PCOD patient, third girl child, MOS, pregnancy, mother's state during pregnancy is still not available as she is adopted by one of the relatives. Patient has excessive hair on the chin. In such cases, can we take rubric like identity confusion or religion identity error? Most of time in PCOD, you can take identity confusion, but now you have to ask yourself that why hair on the chin? So hair on the chin is a sign of hirsutism, and hirsutism is because of there is an excess of estrogens. So why this why this lady goes into this many type of personality? So you need to ask questions that why she is weak at the feminine part and why she have to become a masculine. So for PCOD, you need to go to the lecture of mine where I had explained all the causes of PCOD in that lecture. So you will get your identity. Identity confusion is one of the entry point in PCOD. You can take it, but you need to ask everything in the patients. Directly, you cannot take it. So you have to watch the video of PCOD, approach to the cases of PCOD. I had shared one case of sir, and then I had shared the approach to the PCOD so that you can get the idea of that in that video. So thank you so much. Thank you all. Thank you.